Hey, I'm here with Dr. Jimmy Ellis, who's been a longtime sponsor of Unite. Dr. Ellis, can you tell us what kind of care you provide for your patients and where you practice?
Sure. I'm a general medical oncologist, a hematologist, and I also do some palliative care. I'm with Turo's group, so I do most of my work either in New Orleans, a little bit in Metairie, and I have one day a week that I work in Algiers on the West Bank.
And what led you to become a doctor? Was there a specific childhood instance that made you want to become a doctor, or an experience that you had in your schooling, and why did you choose oncology specifically?
So I guess the first time I thought about medicine, my grandmother lived with us and she had multi-infarct dementia. And when I was in high school, I provided care for her. It was a time before hospice was available in the home.
Right.
And when caring for her, my mom said, you should probably think about being a doctor or a nurse.
Oh, that's really great. Now, being in the oncology field can be difficult because you're dealing with a lot of stressful situations, a lot of really anxious patients. What can you do as a doctor to help ease their anxiety? I'm sure being an oncologist, you have to have a lot of compassion and empathy to really understand what these people are going through. But what can you do to kind of ease their fears?
Well, I think the unknown is the greatest fear.
Right.
Cancer carries with it a very negative connotation. So the sooner we can get with someone and get them as informed as possible and explain to them that there are things we can do, the sooner I think they'll be at ease. It's still extremely stressful, but I find that the stress level goes down once we've been able to communicate.
Right. And explain things in a way that they can understand.
Right.
Right. So you have been practicing for a long time. What sort of advancements have you seen in terms of what's available for cancer patients, whether it's specific drugs or just the nature of treatment and maybe the duration? What sort of advancements have you seen?
So, the changes that have taken place in the last 15 to 20 years have been profound. Some of it is getting a better understanding of cancer and being able to specifically antagonize the things that make cells malignant. We've been able to identify mutations that can be targeted. We've developed drugs that use the immune system effectively. Surgical techniques and radiation techniques have also become much better. And probably the big thing is what we call genomics, or having a molecular picture of the cancer so that we can choose better treatments for it.
And what things do you think we as a whole could do better as far as cancer is expensive? So what sort of things have you seen in terms of what your patients feel stressed about?
Well, it's not unusual for people to go bankrupt when they get sick in America. It's a sad reality of our system, which does such a poor job of caring for people. I think the financial demands are stressful, and I think if there's one thing I could change, it would be that we alter our system to better meet the needs of people who aren't independently wealthy.
Right. And you've been a sponsor of Unite for many years now. And what value do you see in having the Unite organization for not only the patients, but even their caregivers?
Well, I got interested in Unite because a college friend is a Unite alum, and she told me about it. And so I learned more. And once I found out about it, I got involved. I think it's individually good for people fighting cancer to feel like they have a tribe around them who have maybe gone through the same thing. They have a shared experience, and they represent a lot of resources. The individual programs are wonderful, and there's probably too many to go into detail, but just the main show and all the training that goes into it, and things like SCART, availability to be able to speak to someone in a crisis situation. These are all very good things. It does help families as well. Cancer affects families, not individuals. If someone you know is fighting cancer, you're dealing with a lot of stress, and when you see your loved one feeling better and happier, it's better for you too. Unite is essentially a family. A lot of us have been together for a long time. We kind of almost think of one another that way. Right.
And you've also served on the board for quite a long time, so we really appreciate that as well. And I know you recommend Unite to a lot of your patients. And when you have patients that go through the program, what's it like for you to see them up on the stage? I know you don't go through every every program that we offer with them, but you go to a lot of events. So what's it like for you to see them up on stage completely transformed?
Well, I think it's incredible to see them, and for all of our caregivers, typically all of our nurses and support staff go, and to get to see someone who's going through a lot on the stage in a fairly glamorous set of circumstances that most people would never do. It's really very good. It makes us feel good about the work that we do. Cancer can bring people through dark times. This is a shining light for those people in their life.
So if you could describe Unite in one word, if you could just pick one word, what would it be?
Supportive.
That's a good word.
But that's tough. I know. I'd need more time, and people get bored.
But that's a good one. That's a good one. It's hard to sum it up until you've actually seen somebody go through it, or you've witnessed some of the events that we offer. So tell us a little bit about yourself. You're a New Orleans native, right?
So I grew up in New Orleans. I worked in Thibodeau for a long time, and about 5 years ago moved back home. I have 4 daughters who are kind of my greatest joy, and they're young adults now, so I have an empty nest, which is disappointing, but it's cool to see them go out in the world and do good things. Right.
Any of them going to follow your path of becoming a doctor, you think?
One of my daughters is an MD, and she's a resident in pediatrics. My oldest is an audiologist.
Oh, wow.
And then the younger 2 are both in health and people related fields as well, still in school.
Oh, that's wonderful. Well, we really thank you for all of your support and for serving the Unite community with your expertise and compassion and support of our organization. So thank you so much, Dr. Ellis.
Thank you.